Thrombotic Microangiopathy TMA. It is a small vessels injury by the immune mechanism, autoantibody formation, infection, hypertension, pregnancy, and plenty of other diseases. So, and consuming the platelets, thrombocytopenia, and injuring the RBC, and it's being broken down, hemolysis. So, microangiopathic hemolytic anemia, MAHA. You have a different organ injury. The commonest one, gravest one, is the acute kidney injury. You call it hemolytic uremic syndrome. When there is other organ injury, predominantly the CNS, gut, pancreas, and others. So they have their disease is called the TTP, thrombotic thrombocytopenic purpura. So it is continuous complement dysregulation with alternative complement pathway. And etiological factors over here, by far the infection, shigellosis, was in this country, and STEC, the Shiga toxin producing Escherichia coli 0157 was H7 in the USA, Canada, and then Europe. It is 026 strain, and in Australia it is 0111 H8. So 95% cases it is the Shiga toxin producing Escherichia coli or Shigella dysentery type A, and pneumococcus, Streptococcus pneumoniae, 5 to 15% of the HUS. They release neuradenase, an enzyme which causes T cell T antigen exposure, expression by your cells, and ultimately anti-T antibody. They could destroy the RBC, and Frederick-Jackson antigen exposure, and you have the plasminogen activator, you have pneumonia presentation, you have empyema, you have meningitis, DIC-like presentation, sepsis, all are possible over here. Drugs like the CNI, quinidine, oral contraceptives, your chemotherapeutic agents, interferon, and lupus, pregnancy, and malignancy. They also can cause secondary thrombotic thrombocytopenic TMA, and the presentation is, apart from anemia, the other organ injury like in the acute kidney shutdown, the gut bleeding, intussusception, pain, liver enzyme elevation, your hepatic failure, pancreatitis, you have myocarditis, you have acute respiratory distress syndrome, you have in the severe worst cases RBGN-like presentation in the kidney, and investigations like cystocytes more than 2 milligram you have less the platelet count, you have reticulocyte more than 2.5%, and you have your features of hemolysis in the film, complete blood film. Diagnostic biopsy, kidney biopsy is not needed. Do for genetic test, because autoantibody production, by the small percentage of 5 to 10% of cases of HUS are complement mediated and non-complement mediated genetic disease, and good amount of the time you have autoantibody production. So these cases to be diagnosed by genetic testing and autoantibody measuring, and finally you need to refer these cases to your specialized center, because treatment is quite different and difficult in those cases. Infective cases easy, but the autoantibody and chronic cases, relapsing cases, they are a little bit difficult.